time is life when it comes to a heart attack. So we're going to talk about some of the symptoms of a heart attack. We're going to talk about risk factors for a heart attack. And then of course, I'm going to talk about some of the things you can do to prevent a heart attack, including one thing that you can do to help decrease all or many of the risk factors for heart disease. All right. So just the other day, actually a few months ago, I was listening to an interview with the medical superintendent of the Mount St. John or Celeste Medical Center, Dr. Siobhan Bell. She was talking about how much money the hospital has to spend to ship people out to get specialist care after they've had a heart attack. Now, that's for those who have actually survived the heart attack. Like I said, I know of a couple of people who have died in the past 1 to 2 years. And so as much as healthcare may be available overseas, and some of you might say, hey, I have insurance, I can get my own insurance to be flown out, but that's assuming that you survive the event. So what are some of the symptoms of a heart attack to look out for? Well, let me start by telling you a story. I remember a case of a man when I was working at All Saints Health Center. I was a medical officer at that health center in about 2004, and an older man, he was in his 60s, and he came, never forget this case, and he came to see me in the clinic because he had pain in his neck. It was the left side of his neck. Now, he happened to be an alcoholic who was homeless, so I sort of just concluded the neck pain was because he got drunk and slept on the street and slept in a funny position and hurt his neck. A few days later, the police came to me and said, this man was found dead on the street, and you're the last person who we know who saw him. So they wanted to know what I thought and so on and so forth. And I told them everything. I thought he strained his neck. I gave him some painkillers. Now, a couple weeks later, Dr. Lester Simon, the pathologist, called me to say, that man you saw in the clinic a couple of weeks ago, he died of a massive heart attack. And the pain that he was having in his neck was not musculoskeletal from him straining his muscles, it was from the heart attack. And so he used it as a teachable moment to tell me that neck pain is one of the symptoms of a heart attack. Some people can be having a heart attack and they have zero chest pain, but they can have neck pain. So I was very grateful to Dr. Simon for calling me and using it as a teachable moment to tell me, hey, you know, heart attacks don't have to have chest pain. And so that leads me to talking about some of the symptoms of a heart attack for those of you who sometimes you might want to dismiss certain symptoms as non-specific, but the symptoms, chest pain, yes, left-sided chest pain is the classic symptom, a crushing, heavy chest pain that's just not going away. Otherwise, it's pain in the left side of the neck, pain in the shoulder, pain extending down the arm. Also, other symptoms, shortness of breath, just feeling like you can't catch your breath. Additionally, you might start sweating. We say diaphoresis, you might say cold sweat, just sweating for no reason. You might have a pain in the pit of your stomach. We say epigastric pain right there in the pit of the stomach. For some people, it's not specific, and women especially have atypical presentations. Diabetics may have atypical presentations, or just older people in general, especially very old people who really can't tell specifically what's wrong with them. They just know that they feel off. And so in these atypical presentations, there might be no chest pain or no pain at all, but it might just be that they're just out of breath, especially when they exert themselves, or they might just feel quite nauseous or just extremely tired. We have patients sometimes, older people, they're just tired, they can't stay awake, and it's because the heart, of course, is not functioning properly to supply oxygen around the body. So those are the classic symptoms of heart attack. I mean, I should have said, how does a heart attack start? Why does a heart attack happen? It happens because there's a mismatch between the demands of the heart muscle and the amount of oxygen that they're getting. And this is because there's a blockage of the blood vessels, either a sudden blockage, which would be the actual heart attack itself, or it might be a precursor. You might have warning signs, which we call angina, and that is when the blood vessels are gradually getting more and more narrow because you have plaques forming, and slowly over time these plaques are growing, and the more they grow, the narrower the blood vessel gets. And so with exertion, classically, you're fine at rest, but whenever you walk a certain distance or exert yourself or get emotional, and the heart starts beating more, so therefore it needs more oxygen, but it can't get it because of this narrowing. So that's angina, where classically you exert yourself but then you rest and the pain goes away, compared to actual heart attack or precursor heart attack, which is unstable angina, where it's not necessarily a big plaque. It might be hardly any plaque, but there's an irregularity or inflamed area in the blood vessel that might crack. And at the time when it's a sudden crack, blood cells rush to that crack to help to try to heal it, and in the process of the blood vessels rushing there to try to heal over and smooth over that defect, it's a clot that forms that blocks up the whole blood vessel and starves the rest of the heart muscle for blood. So that's really what goes on when you're having a heart attack, and when the heart muscle starves for blood, you start getting pain. It's like when you're in the gym lifting heavier and heavier weights and your muscles start burning you because you're working harder than the blood flow is able to keep up with your muscles, right? So those are the classic symptoms of a heart attack. And in terms of the risk factors, also, who are the people who will be more prone to having a heart attack? Anybody can have a heart attack, but there's some people who are more prone to having a heart attack than others. So number one risk factor, smoking, cigarette smoking, the absolute number one risk factor. If you are someone who smokes, then you are, even if you don't have diabetes, high blood pressure, any other problems, you are automatically at a quite significantly higher risk for having a heart attack because of how smoking damages, inflames the blood vessels in general, right? Then high cholesterol, LDL cholesterol more than 130, triglycerides, or depending on guidelines, they might say LDL cholesterol more than 100, right? But traditionally 130. Triglycerides more than 150. So high cholesterol is a predisposing factor to heart disease. Diabetes, of course, because whenever there's diabetes, there's irritation and inflammation of the blood vessels, and when there's irritation and inflammation, you have plaque formation, you can have cracks where you have some rush of blood cells and clots forming, all right? And then, of course, there's high blood pressure. If your pressure is consistently more than 130 over 80, that's another risk factor. If you have chronic kidney disease, especially if you're on dialysis, but even if you're not on dialysis, there's still a higher risk for you having a heart disease. If you have heart failure, congestive heart failure, we have swelling and difficulty breathing and so on, that's another risk factor. And then if just old age, so the older we get, the higher, the more likely, the longer you live, the more likely you have to run into some of these problems, all right? And then family history is another quite significant risk factor, specifically if you have and we're talking first degree relatives, especially if your father or your brother had a heart attack before they were 55 years of age, and that's pretty significant. Or if your mother or sister had a heart attack before the age of 65, then that's also a pretty significant risk factor. So any of these if you have any of these risk factors that I spoke about, and the more of them you have, the stronger your risk, or the higher your risk for getting a heart attack. So if you have any of these, and then you were to ever develop any of the symptoms that I mentioned earlier, not just chest pain, but difficulty, shortness of breath, sweating, epigastric pain, just feeling like something is off, something is not right, especially if it's after a bout of exertion or emotional distress, or if you have the warning signs and they're coming more and more frequent. I remember a patient I had in Old Harbor Health Center in Jamaica, where older man, he came to me in the clinic. He said every time he walks from point A to point B, he gets a pain in his chest, he's short of breath. When he stops to rest, it goes away. And this was happening more and more, it was getting more and more severe. So he came to me and I knew exactly what he had. That was angina. He needed to go and see a cardiologist and get the blockages taken care of in his heart. But he had to go to Spanish Town, to the hospital, to get that taken care of. He had to get an appointment and so on. And this was the country. So he sadly didn't have the ability, maybe the finances or whatever, to get to that clinic in time. And unfortunately, we heard a couple weeks later or so that he was found under a tree. He died. So heart attacks, it's a serious thing, and some people do not survive a heart attack. But the good thing about it, the good news, is that there are risk factors that if you pay attention, if you assess yourself or have your doctor assess you, you can know, hey, I'm at risk. And if you know that you're at risk, then there are things that you can do to decrease the chance of you succumbing to a heart attack. So what can you do? Well, let's talk about in an emergency, and then I'm going to talk about after, just general prevention, optimization of your health. So in an emergency, if you have any of the symptoms that I talk about, then aspirin. Well, first of all, you gotta go to the doctor. You have to go to the hospital, not just any little clinic, either an urgent care where they can take care of emergencies, or the actual hospital. I know in Antigua they have a couple of urgent cares now. You have to know, which ones can take care of actual emergencies like that. But when in doubt, you just go to the hospital, the main hospital, because they're gonna have all the ability and the specialists and so on to give you medication, clot busting medications, and all the things, the monitoring that you need of your heart to look for any abnormal rhythms. Because yes, you can have the heart attack, we can do all the things, but then you have to be monitored, because what if your heart trips out into an abnormal rhythm? Then you're gonna need to be shocked back into normal rhythm. So that you don't die from this thing. All right, because the idea is that you want to survive the heart attack so that you can modify your risk factors, and if needs be, to be flown out to get care for the blockages. All right, so aspirin while you wait for the ambulance or the ride or whatever to go to the hospital urgently or emergently rather, you chew on an aspirin, a big aspirin, 325 milligram aspirin, or 4 baby aspirins, because, and you don't swallow it and wait for it to dissolve. You chew it, you bite it up and get it into your system quickly so that it can already act on that blood clot to help prevent more platelets from clogging up that blood vessel and locking off the blood supply to your heart. Okay, so aspirin. And then some of you might already maybe know that you have heart disease, and so you might have nitroglycerin on board, and so you want to take a tablet nitroglycerin under the tongue for it to be dissolved in the bloodstream quickly, and it's a nitroglycerin every 5 minutes for a maximum of 3, and this will help to release, like relax the blood vessels going to the heart that's affected, so that you can get a little bit of blood squeezing through that blocked area and going to the heart to supply to keep it alive until you can get more emergency care of stronger clot busting medications. For men who takes Viagra, you're definitely not going to want to take the nitroglycerin, because then your blood pressure will drop too low dangerously. All right, but then what about just modifying, just reversing, getting rid of all those risk factors? What you can do? Well, it's kind of common sense, because if you have any of the risk factors that I listed, then it means that you got to just take care of them. Stop smoking. Get your diabetes under control, if not reverse, because type 2 diabetes specifically is a reversible condition. It's a lifestyle disease, so obviously if it's lifestyle induced, change the lifestyle and you reverse the condition. Hopefully you don't have any of the permanent complications of diabetes. Control your blood pressure. Pressure should be close to 120 over 80, certainly less than 130 over 80. If your cholesterol is high, you need to modify that as well. Get your cholesterol down into LDL down to like 100 or less, and triglycerides down to 100. All right, so you need to modify all these risk factors. If you have a kidney disease, maybe you need to see the kidney specialist, Dr. Ian Thomas, and get him to tune up those kidneys as best as possible so that you don't have ongoing damage and risk factors. And then heart failure and all those things. Age, we can't do anything about age, but certainly these modifiable risk factors we can do something about. But I did say that there's one thing that you can do that might help all these risk factors, and that is to control your blood sugar levels. Now, everybody thinks that, and I used to think so too, that diabetics are the only ones who have to worry about sugar and controlling the blood sugar. But we know now that even if you're not diabetic, your body might be working very hard behind the scenes to maintain your normal blood sugar levels. Diabetes only happens after your body has failed to maintain the norm. So for years, even before the sugar starts creeping up, that action and damage and so on is working in the background, and that's the effect of insulin that is working. Your pancreas is working overtime, putting out so much insulin to keep those blood sugar levels normal. All right, and so to relieve stress on your pancreas, keep normal blood sugar levels, not just normal, though stable. You don't want to have the spikes and lows. You want it nice and stable, good steady state levels, and that involves 4 things. All right, so I came up with the Beam blueprint, which is 4-step blueprint, 4 ways to tackle blood glucose to keep it nice and normal. First one, burn more sugar. That means that whenever you eat, your sugar comes from sweet things and starchy things. All right, so whenever you eat, you want to move around a little bit so that your body is going to use up, burn up some of the sugar that you take in from the food and drink that you eat. So burn more sugar. Eat less sugar. So you want to be very mindful of the sugar that you're getting. You want to know, hey, am I getting sugar from drinks? Am I getting it from cookies, cereal? And you want to keep a running tally of the amount of added sugar you get, to where you're having no more than 6 teaspoons of added sugar per day. That's per World Health Organization guidelines. 6 teaspoons is the same as 24 grams, because 1 teaspoon is 4 grams. So you want to keep a running tally and make sure it's no more than 6 teaspoons in a day to help you with maintaining that normal sugar level. Absorb less sugar or soak in less sugar. So whatever sugar you have, you don't want to have it on an empty stomach. You don't want to have sweet, pure sugar sweet drink just on an empty stomach like that, because then it's gonna rush into your system, because there's nothing in the way to block it and slow down how fast it's going into your system. So having sugar with fiber, which is why eating fruit is better than drinking the juice, because the fruit is coming with the fiber. And then whatever starches you have with fat and protein, so it's not pure starch rushing into your system and stressing your body and causing your pancreas to produce so much insulin. All right, and then the last step is to make less sugar, because a lot of stress for you, you know, professionals, the business owners and professionals, lawyers and so on. It's a stressful life. It's a stressful life for everybody, but I know a lot of professionals, you're really doing well in your business and profession and so on, but you ignore this at the expense of your health. And then you did all this work to generate this really good career, and then you can't enjoy it because you got a heart attack and you didn't survive to enjoy it. All right, so make less sugar by finding ways. Everybody has their own different way to manage stress. So that's the Beam blueprint. Burn more sugar, eat less sugar, absorb less sugar, and then make less sugar. And if you keep your blood sugar levels down to normal, you can bring down your insulin. When insulin comes down, then you have less inflammation. Insulin, by the way, causes your kidneys to hold on to fluid and sodium. And so having high insulin means your blood pressure is hard to control. Bring insulin down by stabilizing blood sugar, and your blood pressure gets better. Your blood glucose levels get better. Your kidneys will get better as well. Everything gets better when blood sugar levels are nice and stable. And also you can be and you are under less stress, so your body is under less stress behind the scenes. All right, so definitely share this video with someone who might benefit from it. Like I said, heart disease is a growing problem, and I know people who've succumbed to this problem. Hey, some of them are my age, you know, so we need to be very cautious. And if you want to learn more about the Beam Blueprint, my book Beaming Health is available in Antigua at Cindy's Bookstore in the Townhouse Plaza. You can really, it's a nice, easy to read book. Somebody told me that, my goodness, they don't usually read medical, like health books, because they usually full of so much medical jargon. But she said she read the book from start to finish and she actually enjoyed it, like, you know, and she's not done that in a while. So definitely a book that you would get some, if you, especially if you have any little health issue that you want, it's not quite where you want it to be, then you're going to want to read Beaming Health. So thanks for watching. Share this video with somebody else, and I'm coming with a couple other videos. I'm going to do some interviews too coming on this channel. My goal is to help Antiguans, my fellow Antiguans, to get healthy, achieve beaming health without having to take more pills and potions, without having to spend money to go overseas to get medical care. Thanks for watching. I will see you on the next video. Bye.